This is CGTN, China Global Television Network.
Egypt's main cancer institute confirms 17 cases of COVID-19 among its medical staff. Uganda distributes emergency food supplies to vulnerable citizens as a lockdown there continues. And civilian casualties from U.S. military airstrikes in Somalia continue to mount. Hello and welcome to Africa Live on CGTN with me, Beatrice Marshall. Also coming up on the program. Center for Landmine Victims in South Sudan holds activities to curb spread of the coronavirus. And football fans in Egypt decry the suspension of leagues around the world. We begin in Egypt, where 17 medical staff have tested positive for COVID-19 at Egypt's National Cancer Institute. President Abdel Fattah el-Sisi has ordered immediate coronavirus tests for all staff and medics at the institute. Here's CGTN's Adel Mahroui with that report from Cairo.
The coronavirus has infected key personnel at Egypt's top public cancer hospital. 17 medical staff have tested positive for COVID-19, forcing the National Cancer Institute to stop work for 3 days to allow for disinfection of the facility.
This is the biggest outbreak in an Egyptian hospital so far. It has a huge influx of patients daily. Cases have been reported there for over a week, but the management tried to conceal the information. One doctor posted about it online, then 10 minutes later, her post was deleted. Then, management denied having any cases. I think that is what led to that sudden number.
News that the disease has reached a center helping vulnerable cancer patients has worried Egyptians. President Abdel Fattah el-Sisi has intervened and ordered tests for all medical personnel and patients too.
The trust between nursing and medical staff and hospital management has been shook because of this issue. They are in the front line in the war against COVID-19 and they need assurances. Routine and bureaucracy dictates how these public healthcare systems work. So when they suspect a COVID-19 case, there are no instructions to test them in hospitals that are not treating the virus.
Initial investigations indicate that a child infected with COVID-19 may have led to the chain of transmissions at the National Cancer Institute. The authorities have identified 72 people who came in direct contact. All of them have been quarantined. Around 400 patients and staff members have been tested. Many fears as this testing continues, more cases could be revealed, which means there is a possibility that COVID-19 cases have been interacting with people for days. Adel Mahroui, CGTN, Cairo.
Meanwhile, South Sudan has confirmed its first case of COVID-19 on Sunday. The government says the 29-year-old woman arrived from Ethiopia on February the 28th. She's being treated in isolation, but officials are now tracing those who came in contact with her. CGTN's Patrick Yet reports.
South Sudan's government says the patient came to the country in late February from the Netherlands. She is a 29-year-old staff member of the United Nations mission in South Sudan. The UN says she was quarantined on arrival for 14 days, cleared and then started work. She interacted with many people in the eastern part of South Sudan where she was deployed. A few days ago, she fell sick and now tested positive for the COVID-19. South Sudan's government says it is doing all it can to try and prevent the spread of the coronavirus.
We'll do the tracing of the individuals that have got into contact with the lady. Most likely will be tested to see whether they have got infected or not.
South Sudan has one of the most underdeveloped health sectors. Long years of civil war destroyed the little health infrastructure in the country. The World Health Organization says it will continue to assist South Sudan to try and halt the spread.
We have put in place a treatment facility which is not far from where we stand. And this facility is ready to accept patients, and it's been, accepting some of the suspected cases. We're working with the ministry and the partners to ensure that we expand the capacity of this center to be able to take any additional patients.
South Sudan's government has already put up measures in place to prevent the spread of the COVID-19. Juba has suspended all international flights, schools, religious functions, and other social functions that bring together more than 5 people are suspended. Shops that sell non-food items are also closed. Patrick Oyet, CGTN, Juba, South Sudan.
The Ugandan government has begun delivering food to the homes of vulnerable people affected by the lockdown in the country. Uganda is currently under a 14-day lockdown. 48 people have so far tested positive for the coronavirus in Uganda. No death has been reported. Here's Leon Sinyange with that report.
Unloading the trucks with food ready for distribution. This is part of Uganda's relief response in the coronavirus crisis.
This is a coronavirus control system in which we want the upcountry to be safe. People who are here can remain right from here, but also they should be fed so that they are alive.
With the help of security forces, the delivery is being done door to door to avoid crowding at distribution centers. And the first beneficiaries, this community in the outskirts of the capital. More than 20,000 people live in this suburb. The authorities say every household here will get its food ration. Each person will receive 6 kilograms of maize flour and 3 kilograms of beans. It is a welcome relief for this mother and her 2-week-old daughter.
I was working, but after my delivery, I stopped. I really had nothing until now. I am very grateful.
The Uganda government has, however, imposed a 14-day partial lockdown across the country to avert the crisis. With no work and almost nothing to eat, many are facing a huge uncertainty.
People were, as they were still working, we didn't have problems because as we are nearing Kalere market, we didn't have problem. You can go there and get matoke for 1,000 and feed your family. But the president had stopped everyone to work. No cars, no borders, no what. So now at least it is a relief to us, the leaders.
About 1.5 million urban poor will benefit from the food response. The government says it will also distribute food to all hospitals and army barracks. Leon Sanyanga, CGTN, Kampala, Uganda.
In Africa, the number of COVID-19 infections are on the rise. There are now over 8,000 confirmed cases across the continent. And as the pandemic takes its toll, most African countries have shut down their borders, closed schools and banned public gatherings to stop the spread of the virus. Let's now take a look at the latest figures. In North Africa, Algeria has the highest number of coronavirus cases with a total of 1,251, and it has recorded 130 fatalities. Egypt follows closely with 1,070 infections and 71 deaths, and Morocco has nearly 1,000 cases and close to 70 casualties. West Africa has 16 countries with confirmed cases. Burkina Faso still has the most reported cases in the region and 66 recoveries. Cote d'Ivoire recorded 245 infections and 1 death, while Senegal has 222 cases. In Central Africa, Cameroon has the most confirmed cases. In just around 1 month, the country has recorded 555 cases. Chad and the Central African Republic are the only 2 countries with less than 10 cases each in the region. And to Eastern Africa, where Kenya has confirmed 16 new cases, bringing the total to 142 cases in the country. Rwanda has confirmed 102 infections, and Djibouti now has 59 COVID-19 cases. South Africa continues to record a rise in new numbers. The country leads the southern part of the continent with more than 1,500 cases and has 9 deaths. Namibia has confirmed 2 more cases, bringing their total to 16, while Malawi has 4 infections. You're watching Africa Live. Still ahead on the program. Civilian casualties from U.S. military airstrikes in Somalia continue to mount. And a center for landmine victims in South Sudan halts activities to curb the spread of the coronavirus.
You're watching breaking news on CGTN.
Welcome to the world today on CGTN.
Let's go to the Horn of Africa now. And the U.S. government has come under fire over the rising number of civilian casualties in its recent offensives in southern Somalia. CGTN's Abdulaziz Bilo has more now from Mogadishu.
The latest strike killed 5 militants southwest of Mogadishu. U.S. Africa Command says the strikes were carried out in coordination with the Somali government in efforts to weaken Al-Shabaab's military might. Rights group Amnesty International has accused the U.S. Army of causing civilian casualties in its air war, with hundreds of strikes conducted during the decade-long campaign against the insurgent group. The report by Amnesty highlights an increasing number of civilian casualties, specifically in the Middle Juba region, that has since seen an increase in aerial bombardment targeting key Al-Shabaab camps and hideouts.
Al-Shabaab doesn't operate like other forces. It is not based in one specific place. It blends into society and doesn't have specific areas where they can be targeted. If the US targets them from above, and AMISOM and the Somali forces on the ground, it is the public that is affected, causing high displacement.
On one instance, the rights group documented the killing of Mahmoud Salat Mahmoud by a US drone in the town of Jilib. The 53-year-old farmer was also a senior employee of a leading telecommunication company. Washington has conducted more than 30 strikes since the beginning of the year, a major increase from previous years. Since taking office in 2017, US President Donald Trump relaxed rules of engagement for his army generals, granting them broader powers to target militant hideouts in Somalia. Analysts are advising on change of tactics in order to reduce displacement and civilian casualties.
Al-Shabaab can easily be defeated by a trained infantry unit that can launch ground attacks without causing civilian casualties. Such forces should rely on credible intelligence and launch surprise attacks, especially at night. In my opinion, escalation of drone strikes only emboldens the terrorists.
Last month, Somali forces backed by US aerial firepower retook control of Janale, a strategic agricultural town 90 kilometers southwest of Mogadishu, denying the militant group a critical source of revenue. Washington has over the years helped train an elite unit of the armed forces known as Danab that has proved effective in capturing and holding towns. Experts say recent attacks against civilians is likely to kill public confidence, a critical aspect in ending the decades-long insurgency. Abdulaziz Bilo, CGTN, Mogadishu, Somalia.
Aid agencies running rehabilitation centers that support landmine victims in South Sudan say they will stop operations to avoid the spread of the coronavirus. The move leaves beneficiaries of the centers with an uncertain future. People in South Sudan face dangers from many mines left in the ground during the country's civil war. Here's CGTN's Patrick Oyet.
Yokwes Deng was hit by a landmine in 2011 as she was walking to her neighbor's house. The mother of two lost her legs. She has since suffered from depression. It is only this rehabilitation center that has given her hope.
February of every year, I come to this center to get a replacement for my artificial leg. I'm now doing business, selling tea in the market, and I'm also taking care of my children thanks to this artificial leg.
The United Nations Mine Action Service, or UNMAS, in South Sudan says it has so far destroyed more than 1 million explosive devices and 4.2 million bullets. The UN says it will take many years to complete the removal of landmines and other unexploded ordnances. Landmine victims are found across South Sudan. South Sudan has only 3 rehabilitation centers supported by International Committee of the Red Cross that produce artificial limbs and support landmine victims. The 6-year civil war, which ended in February this year, halted the mining in most parts of South Sudan. That led to the maiming of more people.
The number of the patients are on rise. So mainly because we have different causes of amputations, and beside the amputations also we have like traumatic cases. We have the gunshot, which is really the biggest number within, and we have the landmine.
The International Committee of the Red Cross says its operations to support landmine victims are being hampered by measures to contain the coronavirus.
Due to the coronavirus, now we have stopped bringing patients from other centers because we are avoiding the crowded. So we are trying by any means, those who have already been in the center, we are trying by any means to send them back. And that is why our technicians, they are very busy this time in order to finish with the devices of the patient so that they can be booked to go back.
The partial lockdown in South Sudan has denied many landmine victims access to rehabilitation centers. Yokwes Deng is from the northern part of South Sudan. She's now stuck in Juba until the partial lockdown is lifted. Patrick Oyet, CGTN, Juba, South Sudan.
Now, since the announcement of the first case of the coronavirus in Kenya on March the 13th, strict measures have been introduced to curb its spread. The government recently introduced a night curfew from 7 p.m. to 5 a.m. And with people now working from home to adhere to social distancing rules, many are relying on online services to meet their daily needs. Let's take a look.
It's lunchtime in Nairobi, and Helen has just received her order. The rider puts the delivery bag at the doorstep, knocks on the door, and immediately retreats. Helen picks the food herself, then pays with M-Pesa, contactless throughout the process.
We are home and there are a bit of restrictions, so I'll be on call, so I don't have time to quickly whip up lunch yet. I have a conference call that I should be joining.
In addition to meals, Helen also shops for daily essentials online.
This is the farthest this door has gone. I've been home for maybe the last 3 weeks.
For 7 years, Junior Food has provided convenience, but now the context is very different. Consumers are asked to stay at home. Therefore, they are seeing companies like us providing their daily essentials so that they can safely be at home, which means that things like groceries they can access on a daily basis, food, pharmacy care, products, safety essentials.
However, riders delivering goods travel all around the city. Orders are taken from tons of restaurants and supermarkets, and deliveries made to thousands of households, putting customers at risk.
Before we schedule any rider to start, we take those precautionary measures to ensure they have a sanitizer, they have gloves on, they have a mask on, and their bag is clean before they start. And of course, their temperature is measured.
Bildad has worked as a rider for Jumia Food for 2.5 years. He says he's taking extra precautionary measures during this time.
I go to a customer, after finishing my delivery process, I remove the gloves, I place them in my dustbin. I have a dustbin too. That after that, I do go dump them in the general dustbin that we're having within the premises. Today, this is my third glove. We use different gloves for every customer. For the mask, because I'm the person who is using it, I'll use at least five per day.
In addition to restaurants, online platforms are working with supermarkets to supply fresh products.
So we normally stock a lot of products, especially when we know that a certain item, I'll give an example of, let's say, the peppers. Let's say the peppers, we know that they go at a very high rate. We try and manage and ensure that some of it is in the cold room so that when people order, we don't run out of it.
Everyone's life has more or less been affected. Online shopping is now becoming the norm of the day as people observe social distancing rules since the outbreak of the COVID-19. Jane Keo, CGTN.
Well, let's now take a look at your sports news. Here's what's ahead. Football fans in Egypt decry the suspension of leagues around the world.
You don't find the stories of North Africa by sitting on the sidelines.
You've got to get out, go there, and you'll find them.
In the bazaars of Casablanca. Among the crowds in Cairo.
Who come to visit Cairo, the ancient capital of Egypt.
Along the waters of the Nile. Along the sands of the Sahara.
No one else will take you where we can in North Africa. No one else will show you what it's all about. CGTN, see the difference.